So today we're gonna start the local contraindications, which is very important related the extraction, that in which conditions we can do in which conditions we cannot do actually extraction. So let's start it. Bismillahirrahmanirrahim. So the first is the most important is the radiation for cancer. In these patients we cannot do actually uh, in these patients we cannot do actually radiation, or if we have to do, so we have to do before the radiation. Otherwise the a condition will result in osteoradionecrosis, which I have told you actually that the bone healing becomes slow due to radiation. Therefore the extraction is should be done before or either with caution, but the best is actually that you do before the radiations. The second is actually in teeth. It is contraindicated that no one should actually um, extract the teeth which is present in a tumor like squamous cell carcinoma or an osteoma or in a malignant tumor, because this can change the stage of this, and it can and therefore actually it has actually local metastasis. Okay, so one shouldn't do without any knowledge the extraction of such teeth that are involved in any malignancy. And the second which is very pericoronitis. So first of all is actually we know pericoronitis is actually is around the impacted mandibular third molar, or either it is actually related to the impaction of the third molar. So such teeth should not be extracted unless and until the infection is not treated. Okay, so first non-surgical treatment should include if like irrigations or removal of maxillary third molar if it is necessary, because it can relieve your impingement. Sometimes it is so much severe that it causes edema of the soft tissues of the overlining mandibular impaction. So some one should actually then, to relieve her impingement or pain, non-surgical treatment should be used like irrigations and then remove the maxillary third molar. You can give either antibiotics for this for severe pericoronitis, and in order to reduce the complications. So basically pericoronitis is if it is mild, the tooth can be removed in a straightforward manner and immediate extraction can be performed. An acute dental-alveolar abscess is very it is also one of the condition during which basically you have abscess in actually bone. Okay, that has moved to the bone actually. So the rapid resolution of the infection actually sometimes resulting from the pulpal necrosis, when the most actually when the infection most rapid resolution when the infection sometimes happen, actually it can result in the pulp necrosis. So when the tooth is removed as early as possible, matlab in these conditions the tooth should be actually sometimes some people want to red from these infections like abscess. So what they do actually, they extract the tooth, and due to that extraction it results in pulpal necrosis. So therefore it is an acute injury. It is not a contraindication to extraction, but it is difficult to extract such tooth and it can cause in pulpal necrosis. So the patient may not be able to open his mouth sufficiently due to trismus. Okay, and also sometimes it is difficult to reach a state of profound local anesthesia when there is abscess in that specific area. If access and anesthesia consideration can be met, the tooth should be removed as possible. Antibiotics the antibiotic therapy should be started and extraction performed as possible as much as soon as possible. Okay, so first of all I want to tell you that we have discussed here three conditions. We will discuss further more because it is actually local contraindications. तो मैं तो सिर्फ आपको ये एक्चुअली ये बताना चाहती हूँ कि एक्चुअली वी हैव स्टडीड दैट कॉन्ट्राइंडिकेशन टू फॉर रेडिएशंस लाइक रेडिएशंस भी नहीं करना चाहिए, क्योंकि उसकी रिजल्ट में ऑस्टियोरेडियोनेक्रोसिस होती है और इसमें बोन हीलिंग बहुत स्लो हो जाती है, इन्फेक्शन के बड़े चांसेस होते हैं बिकॉज रिस्ट्रिक्टेड माउथ ओपनिंग होती है। पेशेंट ऑरल हाइजीन मेंटेन नहीं कर सकता इस कंडीशन में जब आप ठीक है, तो इससे अच्छा है कि आप एक रेडिएशन से पहले कर दें, बाद में नहीं करना चाहिए। सेकंड हमने डिस्कस किया ट्यूमर में, बिकॉज इट कैन चेंज into another stage, advanced stage. Then third we have actually discussed pericoronitis, which is related to impacted impaction. Then we have also study about acute dental alveolar abscess. So in acute, actually, when some, it is not a contraindication somehow, but sometime when infection is not resolved and you rapidly remove their tooth, it can result in necrosis. So better you can resolve first infection and then as much as soon possible remove the tooth actually. Okay.